I love the SCENARIA View. And looking at CTs, it was probably my favorite one that I saw.
What stood out to us was it has a 83 centimeter gantry opening. The weight capacity for the table is 550 pounds. The table does have a lateral shift to it, so that helps with our technologists back so that they aren't having to be out there trying to pull the patient left or right to get them centered. The ease of use was wonderful. They all just love the machine. I also compared the image quality of the SCENARIA View to other CT units, and the SCENARIA View I thought was outstanding. And our physicians, they are very impressed with the image quality as well.
A lot of our special imaging that our doctors want is a lot easier to do on this one and actually available on this one where it wasn't before.
I already order reformats. It's basically taking the flesh and the ligaments and the tendons off the bone, and I deal with foot and ankle, and I can actually rotate it. I can see it 3 dimensions. I can see if there's fractures that need to be identified and some that plain one-dimensional x-ray misses. And so I think the CT images that we have just are far superior to the ones I've ever seen.
Before we had a 16 slice, which takes a lot of time. It's a lot slower. Now we have a 128 slice, so it's faster. So it's less uncomfortable for the patient to be able to get that imaging that we need for these doctors. It looks much nicer. There's less motion for the radiologist, the doctor who reads it, to look and find out and make sure nothing's missed. So calcium scoring will take a look at your heart to see if you have how much calcium plaque is built up in there. There's no IV, there's no contrast. You lay on the table. We put some electrodes on to get your heartbeat. We have the 3D program, Synapse, and it 3Ds it. It picks out the calcium scoring. It color codes it for us. We also have the ECG gating. It scans in between your beats to make sure that we get the scan at the right time to get the appropriate pictures. It's going to be exciting. It's going to be nice for our cardiologist that's here so that we don't have to send patients out somewhere else to get that imaging done. We can do it right here for him. It's just a well-rounded machine that really is really amazing for our facility to have.